On multiple occasions, I've shared with you the importance of exercise, not only before, but during and after the treatment for breast cancer. And so I'm often asked by my patients, gee, Dr. Harness, do you have any suggestions about how I go about exercise and what's the proper approach? And I don't want to hurt myself in the process. Well, clearly, depending on what stage you're at in the treatment of your breast cancer, you need to be working with your breast cancer specialists, perhaps with people in a physical medicine department that you're at the hospital that you're working with, etc. So you do need guidance locally. But I want to offer a link here at Breast Cancer Answers of a program that I've had the opportunity to review from a very credible source that I'd like to recommend, and will provide the link to this doctor's site that gives you a really lovely overview about how to approach exercise, how to sustain exercise, how much exercise you should be doing. I'm pleased to provide a link to Dr. Moshe Frenkel. He's an MD. He's a board-certified family physician who actually founded the first integrative medicine clinic at the MD Anderson Hospital in Houston, Texas. He's recently returned, as I understand it, back to Israel, but he has granted Breast Cancer Answers permission to link to his overview. And I've got the overview here, and I don't want to go through it in great detail, but I just want to sort of highlight it a little bit. Number one recommendation is that you choose something that you enjoy. How about dancing? How about walking? How about getting outdoors? What is it that you like? The pure movement and doing it on a sustained basis is what's really important. Next step is to start slow, particularly if you're recovering from your surgery or just getting over your chemotherapy or you're just getting over your radiation therapy. You want to start slow, but the hard part is keeping it going. One of the things in talking to exercise coaches through the years, I think an important factor here is to work with somebody. Create a buddy, a pal, or somebody like this to work with you and help you and keep you going, because, hey, let's face it, we all want to stop at times, no matter how committed we are to exercise. But bottom line is start slow. Break it up and do fun things. Remember, you're not going to do this on a sustained basis. Think of your activities and monitor them in some way. Probably a good analogy here is like climbing a mountain. You're not going to climb to the top of the mountain in one day. You're going to lay out steps along the way. Also, figure out ways how to reward yourself as you're making progress along a sustainable, life-changing, I hope, exercise program for you. And also, don't beat yourself up if you miss a couple of sessions for whatever the reasons. And then, of course, the line out of this is, gee, how long should I exercise for? So on this wonderful outline, and the link that we're giving you, Dr. Frenkel has got guidelines about, as an example, walking. Try and find an average pace of about 3 miles per hour. And during an average week, try and get in 150 minutes. And then going down jogging and swimming and dancing, he goes through all of these different kinds of fun exercises and gives you some guidelines. So here, I think, is a good link to something. I've reviewed it. It's coming from a very credible source. As one of the famous companies says, just do it. Hi, I'm Dr. Jay Harness, and I want to share with you important information that I believe that every newly diagnosed patient with breast cancer needs to know.
I'm a breast cancer survivor.
I am a breast cancer survivor.
I am a breast cancer survivor.
And I want every woman to know
about personalized breast cancer treatment
and the genomic test.
A test that helps guide a woman and her doctor
to the best treatment options for her.
Pass it on.